the family decided. Niña, no! So what's up, everyone? Welcome to my channel. And I know I've been gone. I feel like I said this in my video. I just literally got done recording my fashion, video. So I'm not even sure if I mentioned that over there on the other one. Don't really remember. But today's video is going to be respiratory roles in the medical field, and also maybe answering some Q&As. I think I had like a handful that I didn't get to answer because it was after the video I uploaded. I'm hungry, so if you hear me growl, sorry. So as always, like and subscribe, share if you like it, and leave comments below. Support y'all's girl. Y'all are awesome, and just wanted to say that y'all's comments, y'all's awesome support has really motivated me into putting more videos out there and actually taking the time to actually do these videos. So without further ado, let's get started. Hopefully I don't get in trouble for having the background, the music, pero like, I forgot. So let's start with roles for respiratory and code blues. So our main role in code... Why do I always get gas once I start like doing my videos? Like, what the hell? But anyways, our role for code blues are airway management and ventilation via bag mask. Yeah, we do compressions. It really depends on your facilities. I have heard that some nurses and some floors don't have the ACLS, but I've never heard that before. Like, I think I've heard it in my class. We have discussion boards, and one of my classmates wrote that, and I was like, that's crazy. I think everyone should be having their ACLS, nurses and respiratory therapists, and people who are in our codes. But our main job is to maintain an airway, so bagging before a tube goes down and assisting the physician, or there's some places where we're able to intubate, but not here in Oklahoma. Assist the patient with intubating, the stylet, pumping air in the balloon, and listening to equal breath sounds, and securing the tube, and then bagging them to make sure they get oxygen, and ventilating them while their hearts has stopped and they stop breathing. That is our main role in ICU. We're hands-on on that. Some people, some RTs do chest compressions. I personally don't. I know I look tired. Don't know who's again. I personally don't, just because I'm bagging. A majority of the time, there's only one respiratory therapist in a code where I worked, or where I used to work. I don't work there anymore. There's only one. Sorry about that. La gente no sabe cómo respetar aquí en esta casa. I feel like I sound weird, but whatever. So that is our, main function, responsibilities, and codes. Another one is acute care hospitals as an IRT or ACC. In ICU, we're responsible for a lot. Main job function is airway management and ventilation of the patient. So if a patient is not critical enough to get tubed, we place them on BiPAPs, and we continuously monitor them every 4 hours. They changed our protocol. It used to be every 2 hours we would check our BiPAP and vent patients, but we do it every 4 hours. Also, many therapists can get extra certifications. ACCS is Advanced Critical Care or something. I don't know. But you are able to work better and are certified to work in ER and in ICU, and you're able to think and actually be involved more. Also, respiratory therapists are able to get their vascular access training, so you're able to do art lines, PICC lines, mid lines, any type of lines, but there is a certain certification for that. You gotta do a program, or a little I don't know. I asked a lady, and she basically was you take an online thing and you just take a test, which I feel like you gotta do some hands-on. So I might be wrong on that, but that's what she told me whenever I asked her. You also manage the ventilation, the ventilator, the mechanical ventilator. So any settings that the doctor orders, and if you decide to put them on settings, you change it. You do SBTs, which is spontaneous breathing trials. You're able to do certain tests to be able to get the patient off, be able to extubate them. Take the tube out. Extubating them to where they can breathe by themselves. Sometimes you do extubate for comfort care. So that means the family has decided to withdraw care of the patient. And just to let you know, we don't have ¿cómo se dice? Like, I don't know how to say it, but we don't have control over that. A lot of people, when I first started, they're all like, damn, so you kill people? No, honey, I do not kill people. Family or the patient decides on that, and we just have to respect their rights. So if, they had a patient on a ventilator for like weeks, like 3 weeks. Sorry, my baby is whining right now, but my clothes are all over this place, and I just can't have her out because es cabrona and she'll fuck it up. Trust me. So you just have to respect the patient's wishes. You also work with the critical care team, which is intensivists, physicians, nurses, occupational therapists. Not really with them. Physical therapists. Sometimes patients are still on the vent to do physical therapy, as in it is possible to do physical therapy with the vent, like actually walking around like a unit. I do have pictures. I was in a seminar where they make that possible. Unfortunately, where I used to work, they don't have that. They just kind of like do like little exercises on the bed. So yeah, that's like our main role. I know I'm missing some, but I'm getting to the important stuff. You're also able to be on the ECMO team. So I don't know if you even heard about this or anything. ECMO team is another form of treatment to treat ARDS or any vascular pulmonary disease. Like if a patient's not oxygenating, that's usually the last resort. We usually do bi-level and proning, or there's like a medicina for pulmonary hypertension that I kind of forgot, that we do before they do to ECMO. Usually ECMO is very expensive, and it's really the last resort. I've heard that like once a patient's on ECMO, they don't make it, but I've heard other cases where they do make it, so it just kind of like varies. There are ECMO teams where respiratory therapists are able to be in. I'm not sure exactly the role that they do, but ECMO is basically a machine that actually pumps the blood in and out of the body and filters it and puts it back in. Basically, that's what it is. So they just help with that. Another job that you're able to do is being a director of a respiratory department or a respiratory program. That's not really where I want to go in life, but that is also an option for people. Being able to direct the whole program or a whole department sounds pretty cool, but you're the jefe of the jefes. But you work under somebody, and you got to do what they say anyways. That's another role that you're able to do. Another one is an educator, which I am actually planning on getting my asthma educator certification by the end of December. Hopefully, Dios mande. They're kind of expensive, so I will be doing CEUs basically just for asthma educator certification. So I'll let y'all know how that goes if y'all want to know. But you'll be certified to teach patients about their asthma or even COPD. You're able to work at an asthma clinic. Here we do have one asthma clinic. We might have another one, but we do have one important asthma clinic that all the kids go to, a lot of people who have asthma go to, and you basically just work there doing like peak flows, which is how you measure like your asthma, like if it's getting bad or if it's moderate. You're able to do that. You're able to work in diagnostic places, which, because as a respiratory therapist, you should be able to do PFT, which is pulmonary function testing. And that's basically you're like assisting or educating a patient how to breathe inside a máquina to measure their lung volumes. And there's like a lot of lung volumes. You will learn that in respiratory school. You can work like each hospital has their own PFT, and that person just does that. So that job is pretty cool because it's usually a Monday through Friday from like 8 to 4, 8 to 5. and it's pretty awesome. You also can get a certification under the NBRC as the registered pulmonary function R. I don't know what the R means. Testing. So you're registered for that, so you can actually you can get hired pretty fast because you studied that extra credential, and yeah, you're like extra perrona. You can also work in sleep diagnostic or sleep disorder and sleep disorder places. As a respiratory therapist, you also learn how to do sleep diagnosis. So you know, if people have been diagnosed with sleep apnea, or they want to diagnose them with sleep apnea, you can work overnight and hook patients on an EEG and EKG and pulse ox, and basically stay up all night and watch them sleep like creeps, but you get paid for it. Excuse me. And it's also a therapeutic intervention, which, you know, if they do the first sleep test and they test positive for sleep apnea, they test it again with a CPAP to see what works with them. That's actually pretty fun, but you do work nights. And there's also a NBRC credential for that. It's just, I believe it's the CDC, sleep disorder something. I don't know. I will be like putting the right stuff here, because you know, your girl is just not thinking right now. It's been a long day. You can also do home care. There's a lot of at-home ventilator patients, a lot of home patients with nebulizers, a lot of at-home BiPAPs, CPAPs that like therapists can go and check and refill and make sure everything's working right. That's also an option. Another one, a transport therapist. There are therapists who fly on a helicopter or an airplane. I think it's just a helicopter, who just do that, who just transport patients, because you have to know specific, because you know, once you go up, the altitude changes, so the pressures change, so you're more educated and stuff like that. You can also be a professor. Being a professor is just not for me, but you can also help teach other respiratory students, teach a respiratory program, but you need like your bachelor's or your master's for that. You can also work at physicians' offices, majority pulmonary offices. A lot of them have their own little PFT going on in there, so you're able to work in there and assist the doctor. And that's just about it. That is all I know that respiratories are able to do. I know it wasn't like the best educational thing, but it's out here, and if you have any questions, you can let me know down below, and I will answer them on my next video. Thank you so much for watching my video. I know I've been kind of gone, but I have started school, and I'm trying to balance school and life and filming and editing and stuff. So yeah, hopefully I will have these up soon. Thank you so much for all the support y'all gave me. Y'all are like fucking chingones, o sea, chingones for life. That's gonna be my new hashtag. Chingones for life. Chingonas and chingones. Okay, whatever. So thank you so much, guys. Bye. Les vaya bien. Y'all have a bomb ass day, and y'all queens stay queens, and y'all kings stay kings.